a pretty significant lateral sway. And we put some music tones on her, and that helped significantly. Now we're going to do some SOT blocking techniques to increase proprioception, which is going to actually fire right into her cerebellum, to the spinal cerebellar tract. And it's going to activate that cerebellum to start working at a higher level. Because of that weakness on that side, she's going to get what we call a hemisphericity. So her left side is going to have extensor weakness, and then because it becomes uninhibited flexors, you get flexor tonus on this same side, which is going to cause heel tension. This is a big indicator and a problem for plantar fasciitis. And so rather than putting a patient in orthotics or just rubbing their foot, we're actually creating a neurologic balance here, which is going to cause inhibition to the flexors, activation of the extensors, which is going to cause the muscles on this whole side to start summating properly, which will take the stress off and make a balanced situation in her back. Especially here at T6 too, it's right where the latissimus dorsi comes in and attaches here. And so this gets very sore in here because of the weakness there, and then the shunt stabilizer muscles weaken and the shoulder gets to become a problem. So by starting out blocking and doing some of the techniques we do here, it's going to help her whole balance situation. I'm just going to send a few messages back up to the cerebellum and the opposite cortex. We're going to pump the sacrum. Take a deep breath in. So every time you breathe in, the whole sacrum is supposed to flex forward and back. And on her, you can see where she's having her sacrum is stuck in extension, so you get decreased cerebral spinal fluid flow too. So we're going to activate that. Take a deep breath in. You don't have to put much pressure, just a little bit to start the sacrum moving. Breathe in. Good. Now take a breath in. Excellent. A lot of these patients will also come in with a tightness here and some sciatica, and that's because the piriformis muscle is tightening and it puts pressure on the sciatic nerve in this point. So by balancing this out, it'll actually take the pressure off that. We're going to set her T6. Let your ear out. So we've just sent a mechanoreceptor message up to the brain to help activate her extensor muscles back here too, so this pain should not come back. Do some sagittal suture work on her. The dura mater, which runs from the sacrum, comes all the way up to the base of the occiput, and then comes in through the inside of the cranial vault and actually comes and attaches at the sagittal suture here. And right underneath this area is the sensory and motor strip, which can actually become somewhat compromised due to pressure from the intracranial dura mater in this area from strain down at the sacral area. Is that sore?
Mm-hmm.
Especially when I push on it?
Mm-hmm.
Take some deep breaths in and out. I want you to put your hands on the front. When I push down, I want you to pull back hard and take a breath in. Breathe in. This activates our 1A receptors in our back, which fire right up to the motor strip and through the cerebellum also to help increase strength in this area. Breathe in and help increase our balance. Out. And one more time. In and out. Take these blocks out. We're going to have her turn over for us for a second. Then we're going to take some, with active release, we're going to take some of the tension off her hip flexors here. And on this side also. I'm going to have you take your eyes and keep your head straight and take your eyes up to the left. When you put your eyes up to the left, it activates the cerebellum on that side. Then we're going to put some cortical input by adjusting her foot. And her wrist. Has your shoulder been bugging you too?
Not too bad.
Hold this up.
I've had a lot of weakness though.
Turn. Because of the lack of inhibition to the flexors, you get flexor tonus on this side, and we'll actually pull the bicep tendon medially, so we're going to set that forward. Hold on here. Bend your elbow. This tickles a little bit. Now hold your arm straight up. Good. I feel like I'm just putting on an act there.
No.
Now we're just, put your arm down here, we're just going to fast stretch a little bit here. Get a lot of adhesions in the neck flexors here too. Does that tickle if I push there?
I wouldn't use the word tickle.
Okay. Now we're going to bring your arm up, hold there. What we're doing is, there's a whole torsion pattern that comes about in the category 1 because of the muscle imbalances. So we're going to set our occiput, which is going to actually take pressure off the dura mater. We're going to do it with our eyes up to the left. Put your eyes up to the left. So our eyes up to the left are activating her cerebellum on this side. Plus we're going to be putting some input with a correction here, which is going to create more activation there. One more time, over here. Hold your arm strong. Eyes up to the left again. Good. We'll just do some stair stepping to loosen this up. As you can see down on that leg too, her foot is turning in more on that side. Let's have you stand up here for us again. Why don't you just stand like that. Hands by your side there again. Now we're going to put these tones back on you. So by utilizing these tones that were made from specific tuning forks, it fires right in through the vestibular system to help activate her spinal musculature. Her cerebellum has been pretty weakened. You can see with the severe sway, but she's starting to slow down a little bit here. Now she's swaying more again. Just look straight ahead, focus on something. Now she's going more forward and back. So swaying forward and back is different than side to side. Forward and back is more of a anterior posterior canals. Side to side is more cerebellum, so we've actually got our cerebellum working better now. Just turn your head this way just a little bit. That totally stopped her now. That feels stronger?
Yeah.
So now as you can see, she's pretty much stopped swaying.
Yep.
So for her, some exercise is on the left side of her body to activate her cerebellum. Some eye positions and also doing some music tones that we've developed will actually help stabilize her, which will help get rid of the pains that she's experiencing for future for her. And this is some things you can really do in your practice to help to stabilize a patient by finding out exactly neurologically what needs to be done and pinpointing your treatments rather than just doing shotgun treatments. Here we really look at specific targets, and as you can see now, she's much more stable. Thank you.
Hmm?
Thank you.
You're welcome.